Hello, my name is Nina Finderle. I am currently attending Kaiser University flagship campus, and I am involved in health psychology at Doctors Brian Sterling. This is my presentation on biopsychosocial review of sleeping disorders. So to start, I would just like to introduce you to sleeping disorders. So sleeping disorders can be explained as conditions that disrupt the normal sleep cycle and that leads to poor quality of sleep or insufficient sleep. It is important to know some of the most common types of sleeping disorders, such as insomnia, sleep apnea, restless leg syndrome, and narcolepsy. So these disorders affect millions of people worldwide and have profound impacts on both physical and mental health. Um, it is important to mention that poor sleep is associated with many cognitive impairments, emotional distress, and even chronic health conditions such as cardiovascular disease. So in this presentation, I'll dive into how biological, psychological, and social factors contribute to the development and maintenance of sleep disorders, as well as explore some effective treatments and diagnostic tools. So let me first dive into what biopsychosocial model is. It is a comprehensive approach to understanding health and illness, and it suggests that biological, psychological, and social factors all interact to influence an individual's well-being. Now, when it comes to sleep disorders, this model help us to see that there's not only one single factor solely responsible for causing or maintaining the condition, but instead, sleeping disorders are the result of interaction of those factors. So, biological factors could include genetic predisposition, psychological factors may involve some mental health conditions, and social factors can involve stressors or environmental influences. And by understanding these connections, we can better diagnose and treat sleeping disorders. So, the first factors I would like to discuss is the biological factors in sleep disorders. They play a critical role in development of sleep disorders. Genetic predisposition, for example, can make a certain individuals more vulnerable to conditions like insomnia or narcolepsy. And there's research that has shown that there are specific genes that influence how our body regulates sleep. Neurotransmitter imbalances, especially those involving serotonin and GABA, can also affect sleep patterns, and that can lead to difficulty falling or staying asleep. And then physical disruption in sleep architecture. For example, those seen in sleep apnea can prevent individuals from reaching deeper and restorative stages of sleep. And even recent neuroimaging studies have provided some insights into how the brain's activity during sleep is disrupted in various disorders. And that's helping to inform treatment approaches. Next are the psychological factors in sleep disorders, and they also contribute significantly to sleep disorders. One example is cognitive behavioral factors. So, individuals who experience anxiety about not being able to sleep may also find themselves trapped in the cycle of sleeplessness. Psychological conditions such as depression and anxiety are also often linked with sleeping disturbance. And in fact, people with insomnia are at greater risk for developing depression and vice versa. Chronic stress can also lead to heightened arousal, and that's just making it harder for the body to transition into the relaxed and sleep-ready state necessary for quality sleep. Also, just to mention, cognitive behavioral therapy for insomnia or CBTI has proven to be one of the most effective treatments for insomnia, and it targets the thoughts and behaviors that interfere with sleep, and it helps patients develop healthier sleep habits and attitudes. But I will discuss that further. And then next are social factors in sleep disorders, and that is also another important piece of the puzzle. Many sleep disorders, especially insomnia, are worsened by work or academic pressure, as well as social isolation. For example, interestingly, college students often report difficulties to sleep due to stress of academic demands, poor sleep hygiene, and irregular schedules. Socioeconomic status also plays a role, and individuals from lower socioeconomic backgrounds may have limited access to quality healthcare and may face greater environmental stressors that also affect sleep. Additionally, it is important to mention cultural attitudes towards sleep, and those differ globally. And in some cultures, sleep may not be prioritized. Also, the COVID-19 pandemic has highlighted low social factors like isolation and disruptive routines can worsen sleep issues. Studies show that many people experienced increased sleeping problems during the pandemic, especially during lockdown and social distancing. The etiology of sleep disorders is multifaceted. So, biologically, individuals may inherit genes that make them more susceptible to conditions like insomnia or narcolepsy. Psychosocial stressors such as job pressures or family problems are often triggers for many sleep disturbances. Then lifestyle factors such as poor sleep hygiene, like inconsistent bedtimes, excessive screen time before bed, caffeine consumption, and others can also contribute to the development of sleep disorders. Then additionally, it is important to mention that people with chronic insomnia often experience a vicious cycle where their poor sleep exacerbates stress and anxiety, and that further impairs sleep. The combination of these biological, psychological, and social factors makes sleep disorders highly complex. Next, I'm going into the evidence based treatment for sleep disorders. There are several that are available for sleep disorders. First one is cognitive behavioral therapy for insomnia, that I already mentioned, is shortened CBTI. And that one has been shown to be particularly effective in treating chronic insomnia. It focuses on changing negative sleep related thoughts, establishing consistent sleep routines, and addressing any anxiety around sleep. Pharmacological treatments um, may be helpful in the short term, but are generally not recommended for long term use due to the risk of dependency. And the next, mindfulness based interventions and relaxation technique like deep breathing and progressive muscle relaxation have also been shown to help reduce arousal and improve sleep. And then lastly, improving sleep hygiene, for example, by creating a comfortable, quiet, and dark sleep environment, as previously mentioned, reducing caffeine as well can significantly enhance sleep quality. Next, I want to talk a little bit about assessment instruments, specifically the Insomnia Severity Index, or shortened ISI. It is one of the most commonly used tools for assessing sleeping disorders, particularly insomnia. So it is a simple self-reported questionnaire that measures the severity of insomnia symptoms. It includes questions about sleep satisfaction, sleep disturbances, and daytime impairments, and it's giving clinicians a snapshot of the patient's sleep problems. The ISI is valuable because it helps identify the severity of insomnia, and it provides insight into how it's affecting daily life and can track changes over time, making it an excellent tool for monitoring treatment progress. So this tool is widely used in both clinical practice and research settings to assess the treatment outcomes and the effectiveness of interventions. So, the Insomnia Severity Index, or ISI, has a significant impact on both clinical treatment and research. Clinicians can use the ISI to establish a baseline measure for insomnia severity when a patient first seeks treatment. This allows them to personalize treatment and to track progress over time. By regularly reassessing insomnia severity with the ISI, healthcare providers can determine whether a patient is improving or if their treatment plan needs to be adjusted. And then in research, the ISI is widely used in studies examining the efficacy of different treatments for insomnia. It provides a standardized way of measuring outcomes and contributes to the development of evidence based guidelines for managing sleep disorders. What I also found interesting is going and diving into current trends in sleeping disorder research. Um, so, the research on sleep disorders has grown significantly in recent years, particularly in the area of COVID-19 pandemic. So the studies have shown that sleep disturbances increased globally during pandemic with disruption to daily routines and increased stress levels. Interestingly, gender differences in sleep problems have also emerged, with women reporting more sleep disturbances compared to men, and that's especially during stressful periods. And another important area of research is the role of physical activity in improving sleep quality. Regular exercise has been shown to significantly reduce insomnia symptoms and to improve sleep quality. That is also offering an additional strategy for managing sleep disorders. So, overall, current research emphasizes the need for personalized treatment approaches and the integration of lifestyle changes in sleep management. For the treatment overviews, to effectively treat sleep disorders, it is important to adopt a multi-phased approach. As previously mentioned, cognitive behavioral therapy for insomnia, or CBTI, remains the gold standard for treating chronic insomnia. CBTI addresses the thoughts, behaviors, and environmental factors that interfere with sleep. In some cases, as we already talked about, pharmacotherapy may be necessary to help patients initiate deep sleep, but it should be only used in a short-term solution. So other treatments such as mindfulness practices and sleep hygiene education also play important role in improving sleep. Sleep hygiene involves simple changes such as maintaining a specific sleep schedule and then avoiding coughing late in the day. And we can also create a calming sleep environment to help. So, by integrating these treatments, we can help patients um, not only fall asleep, but also maintaining long term and restorative sleep. So, at the end, to conclude, um, it is important to understand sleep disorders through the biopsychosocial model, because it allows us to consider all the factors that contribute to both the onset and persistence of sleep problems. By considering biological, psychological, and social elements, we can gain a clearer understanding of how to treat these disorders effectively. Evidence based treatments like cognitive behavioral therapy for insomnia, pharmacological interventions, and lifestyle changes all have their place in comprehensive treatment approach. As research continues to evolve, we'll continue to refine our understanding of these disorders and how to best manage them. At the end, here are my references, and I would just like to thank you for attention. And I hope this presentation has provided some valuable insights into the complex world of sleeping disorders. Thank you.